Hi guys, welcome to OB Basics. My name's Steven. Let's get started. So first things first, you're going to be using the Curvilinear Probe for this exam. You're going to place the probe just above the patient's pubic symphysis with the indicator facing towards the right, and you're going to have to aim a little bit inferior into the pelvis to see everything you're looking for. The first thing you're going to see on the transverse view is the bladder. So this is the bladder here in front of the uterus. And that is helpful if it's full in transabdominal imaging. So you're going to have more success with your OB imaging in a patient with a full bladder when it comes to transabdominal, whereas an empty bladder is more beneficial for transvaginal imaging. Let's see what the anatomy looks like next to the ultrasound. So bladder's up front here, and then you see uterus come in back here. And the reason the uterus kind of sits on top of the bladder as you're fanning through is just this image right here. So this is a shot from the side. And as you can see, the uterus actually overlies the bladder. So this is bladder and this is uterus on top of it. And so what you're seeing is the bladder here and then uterus behind it. But then at the end, you're only really seeing right here, you're only really seeing uterus on top of the bladder. So just keep that in mind. The next shot you're going to want to do is rotate your probe 90 degrees with the indicator facing towards the patient's head. And now you're going to be looking at this kind of image. The bladder here, and then the uterus here, the vaginal stripe behind it, and then the cervix right here. So to get this image, you're going to have to shoot past the pelvic brim right here. Obviously, this bone is going to cause a lot of shadowing, so you're going to have to go just above it and then kind of angled down like that into the pelvis. And this is what you should be seeing. You see the bladder here, and then you see vaginal stripe here, and then you see uterus up here. So you want to follow that vaginal stripe all the way up to the cervix, and then see the endometrial stripe right here. And the endometrial stripe is where you're going to be looking for signs of pregnancy. Now, the uterus could be in multiple positions, so just keep that in mind. It's not always going to be in this normal position, kind of crashing over the top of the bladder. Sometimes it's more vertical, retroflexed, or antiverted. Let's just talk about pregnancy for a quick second. So beta HCG is something we talk about a lot with ultrasound, but there shouldn't be any real beta HCG level that you care about as an emergency physician. And that's because they say 1500 for transvaginal and 2000 for transabdominal is where you're going to see pregnancy, but ectopics can be much lower than that. So therefore, if we're trying to look for an ectopic, we shouldn't care if the beta HCG is low. And you can't really reliably rule out whether or not a pregnancy is intrauterine based on an ultrasound and a beta HCG level. So you really need to either see the pregnancy in the uterus or ectopically to say that it's definitively ectopic or intrauterine, and you shouldn't really be using beta HCG in that portion of your decision making. So when it comes down to it, beta shouldn't matter to you as an ER doctor. So the first sign, though, you're going to see of pregnancy is a gestational sac. Now, this image here might actually have a fetal pull at the very top, but this sac that's within the endometrium right here, that's the gestational sac. So the reason that this doesn't mean that the pregnancy is intrauterine definitively is because you can have a pseudo-gestational sac from an ectopic pregnancy. So you actually have to see content within the gestational sac to say definitively it is intrauterine. Some people talk about this double decidual sign, as one of the first signs of pregnancy. It is somewhat subjective, so in the ER, you shouldn't say that a pregnancy is intrauterine just because you see the double decidual sign. I would go more off the yolk sac. So this is kind of what we say is the first definitive sign of pregnancy. So here you see the gestational sac, and then this little Cheerio in the middle right here, that's the yolk sac. And so if you see that within the uterus, this is a definitive intrauterine pregnancy. Now, as things progress, what you see is a fetal pull. So that's basically just a little amount of tissue next to the yolk sac. And this one, you can actually see the flickering at the base of that fetal pull, and that's the fetal heart rate. And that's usually visible at about 6 weeks. And we use M mode to measure the fetal heart rate. And the reason is the pulse wave Doppler, the one that kind of looks like this, that gives you like the dun 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 sound. That one is actually heating up the tissue right in that pulse wave portion. So it theoretically could cause harm to the fetus. So we use the M mode instead, which is just drawing this line across the whole ultrasound image and then just drags that image out over time. So it doesn't actually increase the energy of the ultrasound at all. You can see, obviously, it's a little harder to make out kind of what's going on here. So you have to practice it. The pulse wave is definitely easier, but we don't recommend it. You will see that some sonographers use it. The literature doesn't really suggest that it is harmful, but there's a potential there, so we avoid it. Again, 6 weeks for that. As you move on, you're obviously going to see an identifiable fetus within the gestational sac. And at this point, you're going to be looking for other things like where the placental is, what position the baby's in. But those are all things we'll cover more in the pathology series. So that's basically it. I hope you guys enjoy doing some OB scans. It's probably one of the most fun scans to do in the department. Reassure your patients at the bedside, and it's fairly simple.